We all know that the sun helps our body produce vitamin D. But what happens during the cold winter months? Do we need to take supplements? Let's find out. Hello everyone, welcome to MedScience Portal. Vitamin D supplements have been a hot topic recently, and this video will discuss just that. First, let's see how vitamin D actually works. Our major source of vitamin D is UVB sunlight. Our liver produces a precursor of vitamin D, which is later converted from UVB sunlight to vitamin D3 in our skin. It moves back to the liver to be finally processed by the kidneys and synthesize the active form of vitamin D. We can also take vitamin D from foods. When we consume foods that are rich in vitamin D, it is absorbed by the intestine and moves to the liver to follow the same steps to synthesize its active form. Then, vitamin D enters the blood circulation and travels to various organs and tissues. There, vitamin D will enter the cells and bind to the receptors in order to induce DNA proliferation and target gene expression. The role of vitamin D is to promote calcium absorption in the intestine and regulate calcium metabolism, keeping our bones healthy. It is believed that normal vitamin D levels decrease the risk of fall and bone fractures in the older adults and may also prevent osteoporosis. Although lesser known, vitamin D plays a role in maintaining normal function of the muscles and of the immune system and partakes in the regulation of cell proliferation. In general, experts agree that vitamin D improves overall health. Following the indications of various health organizations, the adequate daily intake of vitamin D is 600 international units for ages from 1 to 70 and 800 international units for ages over 70. To prevent osteoporosis, experts suggest a dose of 800 to 1,000 international units of vitamin D combined with a dose of 1,000 to 1,200 milligrams of calcium on a daily basis, particularly for postmenopausal women. But what happens when our intake of vitamin D is inadequate? Most individuals with low levels of vitamin D do not present symptoms of deficiency. Prolonged and severe vitamin D deficiency results in low levels of calcium and phosphorus, causing the bones to get less dense and thus more fragile. Symptoms of hypocalcemia, such as numbness, tingling, and seizures, are rarely presented in the absence of an underlying disease. The classic disease caused by vitamin D deficiency is rickets, which is presented in children. Vitamin D deficiency causes bone deformities in the growing skeleton of children and growth retardation. Nowadays, rickets is rare in developed countries. In adults, vitamin D deficiency causes osteomalacia, which is characterized by bone softening and is accompanied by bone pain and muscle weakness. Moreover, there are many medical conditions that are linked to low levels of vitamin D, such as muscle weakness, cancer, cardiovascular events, depression, dementia, and many others. So what are the normal levels of vitamin D? There is no consensus about the optimum serum levels of vitamin D. In general, vitamin D levels of more than 20 nanograms per milliliter is considered enough for good bone health, while levels lower than 20 nanograms per milliliter are considered suboptimal for skeletal health. By using this threshold, many studies have shown that a large percentage of the population, around 30 to 40%, has lower levels of vitamin D, meaning less than 20 nanograms per milliliter. Most of them are asymptomatic and medically they are not considered to have vitamin D deficiency. Certain groups of the population are more prone to develop vitamin D deficiency. These high-risk groups are people with minimum sun exposure, like residents of northern latitudes, and people who are hospitalized or institutionalized, particularly during the winter. Older adults, as the efficiency of vitamin D synthesis in the skin and the absorption of vitamin D from the intestine decline with age. People with dark skin, because high levels of melanin obstruct vitamin D absorption from the skin. People with obesity, pregnant women and infants who are exclusively breastfed since breast milk is low in vitamin D. People with medical conditions such as diseases linked to intestinal malabsorption of dietary fats and kidney diseases. So to answer our question, should we all take vitamin D supplements? Health organizations encourage vitamin D supplementation, particularly during the winter months in areas with short sunshine duration. For those that are part of the high-risk groups we mentioned, it is specifically recommended to take supplements as it can benefit overall health. If you think that your intake of vitamin D is not adequate, you should consult a doctor to help you define the optimal dose for you. What else can we do aside from supplementation? Studies show that 20 minutes of sun exposure of the face and arms is sufficient to help produce vitamin D. Excessive sun exposure, though, is not recommended as it increases the risk of skin cancer. As we mentioned, we can also get vitamin D from nutrition. Some of the best sources of vitamin D are salmon, tuna, mackerel, and fish liver oils. Foods fortified with vitamin D are milk and breakfast cereals, while small amounts of vitamin D are found in cheese, beef, liver, and egg yolks. We mentioned earlier that cardiovascular events and dementia are linked to low levels of vitamin D. It is important to clarify that there is no evidence that vitamin D supplementation may improve the symptoms or the outcome of these conditions. So, it is not recommended to take vitamin D supplements as a therapeutic measure for these conditions. Recommended doses of vitamin D are enough to establish normal levels of vitamin D in the blood, and side effects are small to none. It has been observed that increased doses of vitamin D cause the opposite results and may actually increase the risk of fractures. The upper limit of intake has been set at 4,000 international units per day. Acute vitamin D intoxication is rare and is usually caused by the uncontrolled and excessive ingestion of supplements up to 60,000 international units or by faulty food fortification practices. Symptoms of acute intoxication are due to hypercalcemia and include confusion, polyuria, polydipsia, anorexia, vomiting, and muscle weakness. Chronic intoxication may cause nephrocalcinosis, bone demineralization, and pain. To sum up, vitamin D is essential for bone health, and people with limited sun exposure are strongly recommended to take vitamin D supplements during the winter. That was it, guys. Thank you for watching. We hope you have enjoyed our video. Feel free to share or leave us a comment.